Next, we talk about the investigations for cardiomyopathies. And investigation for cardiomyopathies is more of like, okay, you suspect that a patient has a problem with the heart. That's a problem with the heart muscles, right? Cardiomyopathy disease of the heart muscles. So now, what are the things that you could do to further confirm that okay, this thing that you suspect for actually exists? Okay, so those are the investigative measures you are taking towards what cardiomyopathies. So for the investigative measures, we have them written all here, which we'll be talking about. The gold standard is what? Echocardiogram. All right, echocardiogram. I didn't bring the picture here. I think I spoke individually about these things. I said like I spoke about like echocardiography for cardiomyopathies, MRI scan for cardiomyopathies and all that, right? So in those videos I further on spoke about them properly. Okay, so if you want to watch it, just let me know. So in echocardiography, you can use it to best pick out if you are suspecting that there's what a reduced ejective fraction. So if you are suspecting that the ventricles are not pumping out blood the way they should, either left ventricles or right ventricle, which is usually a great problem, you can do the echocardiography. Okay, then you can use it to pick out what global hypokinesia. Then you can also use it to pick out if the left ventricle, the size, is if it is increasing size. Okay, if there's a hypertrophy on the left side. Then you can also use it to pick what wall thickness, right? You can use it to pick wall thickness. Then that's for echocardiography. Then how about cardiac MRI? Cardiac MRI is a nice one too. It's about 94% or sensitive. It can access things like what myocardial anatomy. It can access for myocardial function and can also access for what myocardial perfusion. Like the amount of blood that is what myocardial perfusion is basically like the blood supply to the heart muscles itself. You know the heart pumps blood but still needs blood, okay? So you want to access for all that. Then the CXR, which is the chest X-ray, you can use it to access for things like what if the heart is enlarged, all right? Like an enlarged cardiac silhouette, which could be global configuration, okay? Then you also use it to what access for vascular redistribution, okay? That's like if there's what edema or if there's distribution of fluid into the interstitial space, you use it to what rule this out, okay, or confirm. All right, then pleural effusions, all right, use it to also confirm if there's pleural effusions. Then for ECG, all right, ECG you can use it to check out for things like if there's tachycardia. You can also use it to what confirm if the heartbeat is normal. All right, use it to what confirm for things like what chamber enlargement. Use it to confirm for things like what right bundle branch block. Then also the what LBB is what left bundle branch block. Then the RBBB is the right bundle branch block. We've spoken about all those bundle branch blocks, okay? We've spoken about all of them. Then also you can confirm for what another thing is cardiac catheterization. I have a video on cardiac catheterization too. So but the summary could be that you can use it to check out for hemodynamics. Use that to check if there's left ventricular ejection fraction. Like you want to check how the left ventricle is pumping out blood into systemic circulation. Okay, left ventricular ejection fraction. So if it is low now, you can now account for why the person is now feeling weak, why the person is becoming ischemic, because that means what oxygen itself is not being supplied to the systemic circulation properly. All right. Then you can also use it for angiography. You can use it for what endocardial biopsy. That's when you want to like take out some small tissues from the heart to send it to the lab. Okay. Then use it for blood test. All right. Or is this no. After this cardiac catheterization, right? This is what you can use it for. So endocardial biopsy is like a different investigation for cardiomyopathies. Blood test is also what a different investigation for cardiomyopathies. So the good news is each of these tests I made a different single video on them. So this one is just like what an overview video, okay, to the investigations that could be done for cardiomyopathies. So if you want to watch any other individual video, just simply let me know.